Hello. The SPOT period, SPOT standing for Safety Programming for Optimal Transformation, is the nation's first and only period hub and uterine wellness center that was co-founded by myself and my daughter during the national pandemic to address the uterine health disparities, especially in communities of color and other vulnerable populations. It is a safe space where people can come and get education, resources, in addition to period care products, and also learn about services that they might need if they're having uterine difficulties or discomforts and get referrals. But more importantly, it's just a space for people to feel vulnerable and share information and learn education and resources to address period poverty and menstrual health insecurities or disorders. So let's talk about some best practices. Some of the practices that need to be implemented to provide our communities with the products that they need are to first listen to the community, listen to what their wants, needs, and desires are around period products, meet them where they are, and provide a safe space and also engage in information sharing, basically having a listening ear. One of the biggest things that I always talk about is make sure that you get full packages of products. Do not separate products or give loose products. That is a negative connotation in our communities when people do these period packs, because again, they deserve a whole pack. Also, if there's a recall, if they're having a reaction, if they're expired, no one would know because they do not have the full package. One of the things also is to realize is that oppression should not alleviate choice. So you need to have their voice and their experiences in the conversation to see what's best for them so that you can provide the services that they need. Otherwise, it's just a checkbox and you're not really reducing the maladaptive behaviors that they might engage in to get the products that they need. When we talk about best practices for referring people in need of period products, I would of course say that whatever the entity is that's talking about this with the young person or adult is to provide the services there. One of the things that you need to realize is that the SPOT period is completely self-funded. We're not funded by the city, state, or federal government, and we are completely booked. So one thing that I would encourage people to do is to create satellite locations wherever they are, whether it be in the schools, whether it be in the hospitals, whether it be in a business, to actually partner with us as the experts who've created something that's never been created before, who has a success rate, to really educate these entities to create satellite spaces so that when they're talking to people, they can direct them somewhere right inside of their building or their facility. That is the best way to mitigate risk around period poverty, because assuming that you talk to someone and then they have to go somewhere else and travel somewhere else or wait on a waiting list, it's just not advantageous. So let's create an ecosystem of equity and an ecosystem of accessibility for our communities to be able to get period products wherever it is that they're talking to someone in need. One of the things that makes myself and my daughter different is that we've been in this space doing this work for over 10 years. And we also have lived experience with period poverty. The best way to address period poverty is looking at menstrual health as a system of care. By looking at menstrual health as a system of care, the products will come. By us having the conversations around menstrual health and wellness and teaching people about their bodies, their reproductive systems, and just how everything works, that way people can feel vulnerable enough talking about irregular periods or issues with their periods or pain, and that way we can provide the services that needs to be implemented in our communities. So of course the period products are another aspect of it, but if we look at it as a whole system, then we would be able to address it in a comprehensive manner as we do with the SPOT period. And I think that's more important, not looking at it as just a socioeconomic issue, but looking at it as a health issue, as a health disparity in a way that we can best impact our communities around periods and menstrual health. The work that I've been doing at the local level, at the national level, at the international level has given me a lens in the political arena by just being able to advocate about the importance of addressing period health and menstrual health as a system of care, and also providing a way for people to have access to free products. I think the biggest thing is that most political systems really do not have a understanding of period poverty or menstrual insecurity or the lack of access to menstrual health services. So I think that's not something that people have thought about it. But because we've been doing this work on the ground in the communities for so long, we're just really bringing the voices to the communities, to the tables that they're not invited to. We're bringing their experiences and our experiences so that we can counteract and contradict the misconceptions that are out there around period poverty. Many people who are in this space come from a privileged ideology and they've never experienced it, never really talked to our communities. So I think it's important that we bring the reality of what's going on, whether it's a young person who's using a sock and toilet paper, or a person or an adult who can't go to work because she has endometriosis and doesn't have resources, or a person who has a bleeding disorder who is bleeding all month. So I think my knowledge, my activism, and my advocacy comes from lived experience, and also just being in my community every day, doing this work every day, all day throughout the year.